Do you suffer with pain while you're having sex? Do you feel like you're the only one that this has ever happened to? Or have you ever tried to talk to one of your friends about it and had them kind of look at you like, what? I have no idea what you're talking about. Well, today we're going to talk about it. I had a patient come in recently and she said she was sitting around talking with her girlfriends and talking about how they have leakage when they're jumping on the trampoline or things like that. And they were kind of laughing about it and stuff like that. And then she's like, yeah, and then there's the pain with sex. And everybody looked at her and said, what? What are you talking about? And it wasn't a great moment. And it made her really feel like she's the only one who's ever had that problem. And she didn't know what to do about it. So luckily, she was willing to reach out and talk to me. I'm Dr. Amy with Physical Therapy for Everybody, and I am here to tell you that if you have pain with sex, one, you're not the only one. There are other people out there. But two, it's not normal, and we need to fix it. I understand that sex is a very important part of a relationship. We want to be able to have that intimacy. We want to be able to have that connection with our partners. But boy, when it's painful, it's super unmotivating to do that, right? And it becomes a barrier, and nobody wants to live with that for the rest of their life. But a lot of people who come in and see me think that there's no other way. They think that, maybe they've talked to their doctor about it and their doctor's like, I don't know what you're talking about. There's nothing that can be done about it. Or maybe they're too scared to talk to their doctor about it because they're like, I don't know if my doctor can help me or if they're going to think I'm weird, or I don't even know how to start that conversation. Well, no worries here. We're more than willing to talk about it. And we see a lot of people actually who are struggling and having pain with sex. There's lots of different reasons why it happens. So obviously we need to do a full evaluation to figure out why the reason, why it's happening for you. But we can find the cause, and everybody so far has been able to be helped, and we've been able to get them back to a pain-free sex life. And it's so fun because it's a great thing to be able to do pain-free again. I mean, any activity is nice to be able to do when it's something that's important to you, but it's next level when we're talking about sex. Now, to be fair, I should mention on this video that I don't treat men. I only treat women with pelvic floor dysfunction. There are other therapists who treat men as well because they have pelvic floors too. But in this clinic, I only treat females with pelvic floor dysfunction, and specifically who have difficulties when they're peeing when they laugh, or they're having pain during sex, or both. So if this sounds like you and you feel like I have been waiting for somebody to tell me I'm not a weirdo and that there's a solution, I'm here to tell you you're not a weirdo, and there definitely is a solution. And I know it may be a little bit awkward to call somebody on the phone and say I'm having pain with sex and I want somebody to help me, but that's what I'm asking you to do. I'm asking you to give us a call. We will not think you're a weirdo. You will be like many of our other patients. And let's talk about what's been going on with you, how long it's been going on. Let's find out more about you and your story to see if you're a good fit for what we offer here at Physical Therapy for Everybody. And I would also say if you've been told that you need to have surgery, I would really recommend calling us first. There sometimes are some things that we can do that can help either pre-surgically or even potentially to avoid surgery. So I actually had a patient come in yesterday who is, she has issues with endometriosis, which she has decided is surgical, which after talking to her, I 100% agree. There's nothing that I can do to help her with the endometriosis aspect. However, because it's been going on for so long, she also has pelvic floor dysfunction. So we are going to give her some tips and ideas before she has surgery. And then, of course, the majority of our rehab will be after she has surgery, because then, of course, things will change surgically. They will change after the surgery, and that will affect her pelvic floor. So most of her therapy will be done afterwards, but we are going to start beforehand to help make that surgery as successful as possible. So in situations like that, obviously, yeah, I can't cure endometriosis. Boy, if I could, wouldn't that be fantastic? But I can help with some of the side effects that come with endometriosis that affect the pelvic floor. So if you have questions, if you're having pain with sex, if you are frustrated in more than one, and you feel like nobody has been willing to talk to you about it, or you just haven't felt comfortable because it's a really uncomfortable topic to talk about, I can tell you I'm more than happy to talk about it. We will talk about the nitty-gritty because that is really important and relevant. But if you've been looking for somebody to talk to, you know how valuable that is to be able to share that information and have somebody help you and walk you down the path to being able to have sex pain-free. And I guarantee you that we can get there, and I guarantee you will be glad that you went on that journey with me. So the first step is to give us a call. We want to do that body check because, again, we do want to make sure that you are a good fit for what we offer here. Our phone number is 425-658-4944. After we do the body chat and we've determined that you are a good fit, we'll sign you up for a discovery visit. So you get to come in and talk to me one-on-one, get your questions answered about how we do all the things. And make sure that you feel comfortable moving forward, so you know what this is going to entail, and just get all your questions answered so you feel comfortable. We do get it. It's a really difficult thing to talk about. It's really weird to think about treating, but most people find once they come in and get started, it's actually not as weird as they thought it was going to be beforehand. So we do everything we can to make you as comfortable as possible. We do have private treatment rooms. They have a door on them, so you won't be out in the middle of a big gym or anything like that. And we'll try to make you just as comfortable as we possibly can while we deal with this very uncomfortable issue. So I encourage you to give us a call. Let's have a body chat. Let's talk about what's going on with you and see if you're a good fit for what we offer here at Physical Therapy for Everybody. Have a great day, everyone.